They say you shouldn't judge a book by its cover. After all, it's what's on the inside that really counts. And just because something looks good, it doesn't mean it is good. And this is certainly the case when it comes to food. Unfortunately, we live in an age where food can be made to look extremely appealing, mouth-watering in fact. But on the inside, it can wreak havoc. Now, it's hardly surprising that over the course of a lifetime, if we consume only junk food, it can take its toll on our health. Did you know that we consume about 6 garbage trucks full of food over an average lifespan? However, what we're discovering is that it's not just years of abuse, years of poor nutrition that takes its toll. Every meal counts. And in this segment, what we're going to consider is the difference it makes on our inside when we consume this as compared to this. And what you'll be fascinated to learn is that good choices make a difference every time we make them.
Good afternoon, good morning, good evening, wherever you are in the world. I'll say good day to you. I want to thank everyone for participating. It's actually great to do these Zoom sessions. I can look in and see where everybody lives and what their rooms look like. This is really interesting, an interesting time. I want to thank everyone for participating. This is the 4th webinar that we're doing. This is CHIP module session number 3, just for everyone's information. And I want to thank the people that are joining for the first time and coming back again for a second visit or a third. We will talk today and really learn more about the value of CHIP as what I call a solution, the solution, or one of the solutions for the healthcare crises that we deal with today, which really is a global problem. When you really look at every country, and certainly every developed and developing countries, we have similar health problems. And I think CHIP really provides a significant solution to the healthcare crises that we deal with today. Before we really get into the program, you can put on the bottom of your screen, there's a chat box. You can put information in the chat box, a question. I'd like to really keep the questions to the theme that today's session is all about. And the theme for today's session, which again is CHIP session number 3, is the common denominator of chronic disease. And I added the common denominator of chronic disease in America, but it really is for every developing country. And before we really get into the common denominator, I'd really like to spend a moment just talking about chronic diseases or chronic illnesses. And these are the illnesses that people suffer from on a daily basis and unfortunately die from on a daily basis. And the chronic illnesses, for most of you that are healthcare providers and others that are not, I think people really understand. Heart disease is is actually the most common chronic illness that we deal with. And the term heart disease is used, but I think it encompasses many illnesses which we're familiar with. Heart attacks, congestive heart failure as that relates to coronary artery disease and high blood pressure. Strokes is in the same category. Vascular dementia. Most of the dementias that we see are not necessarily Alzheimer's related, but really seem to be more related to a vascular problem. And I will explain what that's all about in today's session. And even erectile dysfunction for men, I call that the canary in the coal mine, because when arteries get clogged, it affects the function of the organs. And that really is throughout the entire body. And then peripheral vascular disease. So all of those illnesses really are encompassed in the words heart disease. And this is really one of the most common chronic illnesses that we deal with. Metabolic syndrome is another chronic illness. That encompasses diabetes. I don't know if you've heard the word diabesity. Diabesity is the combination of 2 words, diabetes and obesity. But those 2 things really go hand in hand pathophysiologically. And those 2 are really in the terminology for metabolic syndromes. High blood pressure, high cholesterol, high blood glucose, insulin resistance. All of these are chronic illnesses, and they absolutely relate to chronic diseases and what we're talking about so far. Pulmonary diseases such as COPD, which is emphysema and asthma, inflammatory arthritis, and other chronic diseases. So all of these illnesses are part of what we call the common denominators of chronic illnesses. And we're going to talk a little bit more about inflammation. So next, we're going to just show a slide that is entitled The Introduction to Inflammation. So we'll put that on the screen next. What we have here is a slide that says what causes inflammation. And as you can see on the slide, animal fats, trans fats, high fat diets, inactivity, excessive alcohol, excessive energy intake, too many calories, if you will, low fiber intake, salt, sugar sweetened drinks, obesity or weight gain, sleep deprivation, stress, and smoking. So all of these things cause inflammation in your body, and this really is a systemic problem. Below that, it says what opposes inflammation, or what actually improves or decreases inflammation. And you can see on the slide here, fruits and vegetables, and we talk about that obviously numerous times throughout the program. Herbs and spices, all of the chemicals that are in spices, and that's one of the reasons that you should be cooking with lots of different spices, because there are anti-cancer and anti-disease chemicals in herbs and spices. High fiber diets, one of the reasons that high fiber diets are great is because that lowers your cholesterol level. Physical activity, restricting your energy intake, that basically means eating fewer calories than you really need to maintain your weight, and lots of water. So all of those things that either cause or decrease the inflammation in your body are really important for health in general. When we look at inflammation, we have to talk about this as a systemic disease. And when we talk about inflammation as a systemic disease, the words endothelial dysfunction, and I'll explain that, endothelial dysfunction come into play. The endothelium is the inside lining of your arteries, and when inflammation occurs from all of the reasons that we mentioned previously, that causes a problem with the arterial function. The endothelium, the inside lining of your arteries, becomes dysfunctional, and that's when plaque starts to form. And we're going to look at the next slide, which is the progression of inflammation, and I'll explain this slide to you. Not everybody all of a sudden just has a problem with a clogged artery, if you will. That's a progressive problem that in most developed countries, and certainly in America, it starts early with endothelial dysfunction. That's the beginning of it. And the end result is when the arteries get clogged. The progression of inflammation, again, starts with systemic inflammation in the arteries themselves, endothelial dysfunction, the inside lining of the arteries become dysfunctional. And then as plaque starts to build up in the arteries, you get less and less blood flow to whatever organ that artery is supplying, and over time the artery itself becomes dysfunctional. So as you can see on the left side of the screen, this is as if you cut the artery open and you're looking inside the artery. On the left side of the screen, you can see a completely open artery, and as it starts to progress, on the top it says F2 ISOP. On that one, you can start to see on the lower portion that you're starting to get a narrowing of the artery. And as you go from left to right, you can see there's less and less space, less and less of the lumen, the opening where the blood actually goes through, and there's more and more resistance to blood flowing through that artery. So oftentimes what happens is we identify hardening of the arteries when the person is all the way to the right, when the artery has already clogged, the person has a stroke, or the person has a heart attack, or they have some problems with blood flow in the lower extremities. You obviously want to diagnose those problems early on when the systemic inflammation is first developing and when the endothelial dysfunction is first developing. So thank you for that slide. So we're going to talk next about risk factors that come into play that start to cause this systemic inflammation and starts to cause the blockage that we just saw on the screen there. So we'll look at the next roll-in, which is called risk arch disease markers.
As these disease markers, these indicators emerged, they began to call them risk factors because their presence elevated the risk for heart disease and other chronic diseases. To make it a bit more interesting and educationally valuable, I've put these classical risk factors into an arch. So if you look at the first three, the top three risk factors, you will look at cholesterol, the LDL cholesterol, you would look at smoking, and you would look at high blood pressure, right? The more of these risk factors, the greater your risk. Some of these lower risk factors, such as age and gender, are not easily changed, but we can do something about the other risk factors. These classical risk factors have become well established, and they're powerful disease predictors for population groups. They allow us to make mathematically driven estimations of risk for populations.
So you can see from that arch that there are certain risk factors that are more common and more disease-causing, if you will. So when you identify, and this is something that all of us that work with the CHIP program can do, when you talk with people and you get an idea of what their lives are like and what their behaviors are like, you can start to assess risk factors. And from that information, you can really start to give people some suggestions on what would be helpful to start moving them away from disease to being on the healthier road, if you will. So when these risk factors become chronic and they're unchecked and we're not doing anything to mitigate or to lower those risk factors, that's when organ damage starts to occur. And as I mentioned before, the number one disease that we deal with in this country and that so many people become disabled and die from is heart disease. So the next roll-in is a little bit more information about heart disease that we'll watch.
Heart disease. It really is a progressive disease, isn't it? Because by the time we're about 20 years of age, cholesterol, fats, and calcium have already formed plaques that narrow our arterial lumen by about 20%. By the time we're 45 years of age, the killer is growing inside of our arteries, narrowing our arterial lumen now by about 50%. And by the time we're 70 years of age, many live with a 90% narrowing, leaving only a 10% opening for blood to flow through. These plaques harden like rock, and still many have no symptoms until the killer strikes.
So that's an interesting slide, an interesting video, because oftentimes what I hear from a lot of patients is that I had a test done to measure the carotid artery opening, or I had a cardiac catheterization and they gave me some information about the blood flow in my heart. And I was told that I had a minimal problem because it was only 20 or 30% blocked in the carotid artery, or 20 to 30% or 40% blocked in the coronary artery. When you think about it, you want 100% blood flow in your arteries. You never want to feel that, well, I only have a little bit of blockage, so it's not that bad, because really reversing that disease is usually a very difficult problem. So we really want to be sure that we have completely open arteries so that the organs are healthy and vital and functioning normally. And really, when we look at what people actually die from, it's interesting because oftentimes what you see typically on a death certificate is a diagnosis. It says the person died from a heart attack or the person died from a stroke. In reality, what the individual actually died from was poor nutrition that caused the heart disease or the stroke, lack of physical activity, and usually in many countries, the use of harmful substances, especially cigarette smoking. Cigarette smoking does major damage to the arteries. So in reality, what should be listed on the death certificate is the person died from eating a poor diet, not being physically active on a regular basis, smoking cigarettes, and doing other things that are harmful to the body. This is the standard American lifestyle and the standard American diet. That's typically what people actually die from. So I really like to also mention the places in the world, these blue zones. These are 5 places in the world where there are more people living into their hundreds than any place else in the world. Icaria, Greece, Okinawa, Japan, Sardinia, Italy, Loma Linda, California, close to us, and the Nicoya Peninsula of Costa Rica. The reason that these people live so long is because they do things that keep them healthy, and they do them naturally. They eat healthy food, they are physically active, they sleep enough, they have great stress management and support. So we want to look at places, and we want to use the CHIP program to encourage people to do the things that contribute most to health and wellness and vitality. So that's the commonality, as I mentioned. And really what I would like to pass on as a message before we get to some questions is, what are you teaching your participants in the CHIP program? What can we all do collectively to identify risk factors, to lower the risk factors, to move people in the right direction of better health, and to really give people the tools and the understanding, especially for everyone involved here, that the CHIP program is a healthcare solution. It continues to move people in the right direction so that we can be healthier and we can live with vitality and purpose. We have one question that came in. Can you explain antioxidants and free radicals? Yes, that's actually a great question. It obviously relates to the theme today when we're talking about arterial inflammation. So oxidation, what happens to a piece of metal when you leave it outside in the rain? The answer is it rusts. And you can think of oxidation with the same analogy. Inside the cell, free radicals, they call them. These are oxygen particles that are bouncing back and forth inside the cell, creating a lot of havoc inside the cell, and it causes oxidation. Rusting inside the cell, obviously, like rusting of a piece of metal that you leave outside, is obviously a bad thing, and that's what causes the inflammation. Anything that causes oxidation in the body is going to cause more inflammation. The inflammation causes problems with endothelial dysfunction, and that's what decreases blood flow to an artery, and that's when the organs start to fail. So antioxidants are things that do exactly the opposite. And where do you get your antioxidants from? Not from pills, typically, from the things that you eat. Healthy fruits and vegetables give you hundreds of antioxidants, which will keep your arteries open, blood flowing nicely through the arteries. The organs are healthy and they're functioning the way that they're supposed to be functioning. So the short answer is, get your antioxidants from the foods that you eat. That's really what causes the best health in all of us. But again, using CHIP as a tool to really allow people to completely understand that this is a solution to the healthcare problems that we deal with today. I really want to emphasize that we're not just selling a kit or a book or a video. We're really selling the ability for people to really understand what they need to do to stay healthy. Next question that came in, what effects will a plant-based diet have on our cortisol output? Can the effects of this stress hormone be reversed or mitigated by adhering to the CHIP program? So cortisol is the stress hormone, and stress is actually helpful to a degree. When you think about it, if God forbid there's a fire in your house, you have to get revved up immediately and get out of the house. Well, the body creates these enzymes and these hormones that help you to deal with the stress at the moment. But when chronic stress affects our body, that's when the cortisol level gets completely out of control. And I think the short answer is yes, a plant-based diet can help with that, because anything that decreases your body's ability to have blood circulating throughout causes the organs in your body not to be functioning properly. So the adrenal glands are where you make most of your cortisol, and if you're not getting proper blood supply to those organs, then you're not really able, then the organs are not able to function properly. So a plant-based diet, a whole food plant-based diet, absolutely helps in every situation where the body is moving in the wrong direction towards disease and not towards health. So the short answer is absolutely yes, it can. the body is only able to make the proper hormones. There are dozens of hormones, if not probably 100 hormones that the body has to make on a regular basis. And if you don't supply your body and your cells with the proper nutrition, with the proper macronutrients, proteins, carbohydrates, and fats, and all of the micronutrients, all of the vitamins, minerals, and antioxidants, the body can't make the hormones and the proteins and the cell structures and everything that the body needs to stay healthy. Can you explain probiotics and if they are good to take as supplements and the difference between probiotics and antibiotics? Okay, so we will talk more about the microbiome in one of the upcoming sessions. And probiotics are actually, they're actually bacteria that you need in your system. So the microbiome is the area in your colon and in your small intestine and even in your the upper part of your GI tract that allows the growth of healthy bacteria, which we need to participate in digestion and absorption of food. So probiotics are necessary, but there's a big difference between buying your probiotics off the shelf and eating your probiotics. So what I generally tell my patients is get your probiotics again from food, the same place that you get your vitamins and your antioxidants. Fermented foods give you probiotics, healthy probiotics that keep your GI tract healthy and the microbiome healthy. And antibiotics are exactly the opposite as far as an effect. When you take an antibiotic, and especially when you take it by mouth, you're killing not only the bacteria that's causing the illness, but you're also killing normal bacteria that's supposed to be in your colon. So you want to be sure that if your healthcare provider is recommending that you take an antibiotic, be sure that it's 100% necessary. In the flu season, we often find people almost demanding that they be given a prescription for an antibiotic. And that's obviously counterproductive because the flu is a virus. An antibiotic is for bacteria, to kill bacteria. So you don't want to take an antibiotic when you have a viral infection, and you don't want to take an antibiotic when it's not 100% necessary. But if you do need to take an antibiotic, you want to be sure that you really get as much probiotic in your system in the next 2 to 3 months thereafter, and eat as many fermented foods as you can to replace what the antibiotic might have killed already. Can you show the risk factor arch again? So you can see on this, on the bottom of the arch itself is age and gender. So age and gender have something to do with health, obviously, but that doesn't necessarily mean that just because you're a male or a female or because you're older that you're going to get a disease, because lifestyle is has more an effect on your health than gender does. And you can see just above, than genetics do. And you can see just above the word gender is genetics. And we know for a fact through multiple scientific research projects that we've seen that lifestyle has more of an effect on your health than genetics does. And then we go up on that arch: triglycerides, obesity, stress, diabetes, inactivity, high blood pressure, LDL cholesterol, and smoking. All of those things on the top part of the arch itself have a significant effect on inflammation, on endothelial function, on the function of your arteries, the ability to have blood flowing through to the organs, and for the organs to be functioning the way they're supposed to function. So we can look at those risk factors and we can tell our individual patients, your weight is too high, you have problems with blood pressure or blood sugar, your LDL is too high, and this is where we really see the value of the CHIP program. When an individual starts the CHIP program and they really start to live that lifestyle, even within the first 3 or 4 weeks, if we measure their blood pressure, their LDL cholesterol, their blood glucose, those numbers are decreasing significantly in the first month or 4 or 5 or 6 weeks. So we see dramatic improvements with using a plant-based diet early on in the program. I'll take this one as the last question because we're running out of time. What is the connection between type 2 diabetes and inflammation? Which is the cause versus the effect, and how does that causality work? So diabetes is another inflammatory disease, and diabetes is usually caused by two things in general. It's not just high blood sugar, it's also fats inside the artery and inside the body and inside the cells. And actually, Dr. Neil Barnard does a fabulous has a fabulous way of really explaining what happens early on when you have too much fat in your system, how it interferes with the function of insulin and does not allow glucose to get inside the cells. Glucose is supposed to be taken from, glucose is the terminology for sugar. It's supposed to come out of your bloodstream, get into the cells. The cells are supposed to use that glucose for the production of energy. But when fat interferes with glucose getting into the cell, because it interferes with the function of insulin, the fat stays in your blood system, in your bloodstream. The glucose stays in your bloodstream. All of that causes plaque formation and endothelial dysfunction and inflammation. So diabetes is another inflammatory disease. That again is the common denominator for all of the chronic illnesses that I mentioned previously. And it really is the cause of the problem. And we always get back to what is the root cause of the problem, because that's what we need to take care of. And if you continue to work backwards, diabetes is usually caused by the foods that we eat in general. And type 2 diabetes occurs in 95 to 98% of the individuals that actually have diabetes. And if we work ourselves backwards to figuring out what the cause is, in most cases, it's the food that we eat and it's the lifestyle that we live. So we're winding down here. I want to really just thank everyone for participating, and just also asking for all the people that are on the line now, tell as many people as you can about the show that we do. Now it's every Wednesdays, same Zoom link, if you will. But before we leave, I want to just invite you to look at a couple of other books that might be helpful when you're talking to your CHIP participants. This one here is called Eat Plants, Feel Whole. It's by George Guthrie, who was the past president of the American College of Lifestyle Medicine. Joel Fuhrman is a great author who has written many books on nutrition and Eat for Health. So if in addition to all of the books and videos that people are looking at through the CHIP program, they can look at other books and other authors. And obviously, so many people know Dr. Greger, his book, How Not to Die. This is the cookbook, which has got some great recipes. So there are so many resources that people can use to stay healthy, to become healthy, and to stay healthy. And again, just to reiterate that lifestyle is what really causes health. It improves our health, it improves our vitality and our longevity. So I want to thank all the facilitators, all the CHIP facilitators for what you do on a regular basis, and thank people on the program today that are either past participants in CHIP or current participants, and invite you back again for next week, same time next Wednesday at 3 p.m. Tell as many people as you can, and in the meantime, stay healthy and be blessed. Thank you.